Up next, we have another power-packed keynote presentation on telemedicine evolution in health ecosystem by Tiago Vacas Felgueira, the product and innovation head AdvanceCare, which also happens to be our gold sponsor. Now, Tiago is working in the health insurance area since 2002, and he has experiences in areas such as claims, production, underwriting, and product. I welcome you, Tiago, to deliver this keynote presentation, and the stage is all yours.
Good morning, everyone. I'm Tiago Felgueira, Head of Product and Innovation from AdvanceCare. I will start to share my presentation.
Yes, now we can see it.
Okay. So, as I'm saying, I'm Head of Product and Innovation in AdvanceCare, and we are AdvanceCare. AdvanceCare is a Portuguese company, a TPA, three-party administration, founded in 1998 by a joint venture between local insurance and Munich Re and United Healthcare. And we was created for handle the rising of health insurance, the private health insurance in Portugal. And that time, we start to have private health insurance in Portugal, and the local insurance needs a partner specializing in health to handle with this new market. And it was our beginning on Portugal. So today we are our only shareholder is Generali Group and Europa Assistance. The evolution of AdvanceCare, and you see the brand and logos. We have 20 years of evolution in Portuguese market. We start with only health insurance, includes body injury, risk assessment, and occupational health and safety service at work. So we are a platform for Generali Group specializing in health. So what we do today? Today we have 1.3 million final customers, 40 institutional clients in Portugal, in Angola, Mozambique, and we are starting to work with Central Europe, with 3 countries in Central Europe. And we pay around 3.1 million euros, 3.1 million claims by year. So our main assets, it's a brand. In health, it's very important. We have for that type of business, we have a recognizing brand. The data, we have 20 years collecting data about health, and it's very important for we advise our customers to choose better approach to create important environment of ecosystem in health. The technological infrastructure, of course, because we need scale, and we need to serve a lot of final customers. So it's very important the interface. The operational effectiveness, the provider network, it's one of our assets when we was created 20 years ago. It was for negotiation with the providers in Portugal, and the clinical expertise. We work with around 40 doctors and the same number of nurses to help us to create guidelines and help our customers in health. So, what is the telemedicine evolution in health ecosystem? The first thing, we start with the teleconsultation in 2017. It was our first approach. What we saw since the beginning and was our choice, because for move clients of the physical way to an online way, it's important to give them more empowerment. And one of the things we choose is because in our market, if you go to a visit, you have pay a copayment. We don't put copayments for clients who use online medicine to increase the usage. What we saw in 2017, 2020, we don't have lots of usage. The customers don't understand what will be better with the telemedicine and the convenience to use telemedicine. What happened was, in the beginning of the pandemic, because everyone are afraid to go to a hospital because they can pick COVID-19, and we have the first lockdown, the telemedicine have a big usage. And if you see in this chart, in the end of the past year, it was 65% more usage than we have on the beginning of January 20. So the pandemic broke new barriers and break others, and helped to increase the adoption. The NPS is 84, is very, very high. People are satisfied to use the telemedicine. And in this year, we double the usage the past year. The frequency is almost the double in 2022 by 2021. So, and this year we don't have today COVID. So, if you see in here the changing, the behavior changing by the customers, what we saw is a big adoption, and we are creating in term telehealth not only virtual health solutions, but hybrid virtual and person care models. This is very important because people don't use only telehealth, and today don't use only the physical. It's both. Depends of type of disease and needs of the customer. What we improve in our user experience. So we start with the online, integrate several services. The one is something we tried in 2020. It was an online triage, a symptom checker with artificial intelligence. The patient eligibility, we have 14 insurers working with us with several conditions, several benefit plans, and we need to have to have the access to the final customer. We need to know who is the customer and what we'll need to pay or not to pay, if access or not access, etc. The electronic prescription, because if you are in the teleconsultation and the virtual visit, the prescription must be electronic, because in the end of the day, the doctor probably will prescribe something, and if you want to receive that by your email. You can also, after you receive the prescription, we have a service for drugs at home. So we include the vital signs. The vital signs is important for the side of the doctor to, before starting the teleconsultation, know more about the patient. Digital referral, online gatekeeping. We improve also the user experience, is total RGPD compliance, and we are increasing the offer for more medical specialties. So our full medicine experiences. The client start with a symptom checker. It's not a mandatory, because we don't want to create new barriers to the customers' access to telemedicine. In Portugal, it's much cheaper for the payer telemedicine than the physical one. So symptom checker is important for two things: the side of the customer and the insurers. First, we have information about the symptoms of the patient, and we can make the correct referral of the patient according to the symptoms in their benefit plan. And we give that information to the doctor if the client chooses teleconsultation, and the doctor have context about that symptoms. In the sides of AdvanceCare and the payer, we collect a lot of that data, because in the past we only know the data about when the customer send the claim or use a doctor, and today with the symptom checker we can have information about the needs of the client, and it's very important. A good example is in the last 2 years, we saw increasing of symptoms related with mental health. So the new product we launched in the last quarter was a mental health in telehealth with a psychologist and psychiatric program for our customers. Update the patient records and engage the user is the, the final scope of the symptom checker. So we make the referral in onboarding for the correct type of specialty according to symptoms. The client choose the doctor. Is important for the client see who is the doctor doctor for have their needs, verify the user eligibility, and show to the client who is the doctors available for each specialty and what will be the for the best booking for them. They make the schedule, they make the payment. They have several options for make the payment: credit card, a bank reference, or also with the phone number if you are linked to a bank with your phone number. Book the consultation and we send the confirmation. The client gets the teleconsultation. The teleconsultation can be video, phone, or chat. Video is the ideal. However, sometimes problem of connecting issues or bad Wi-Fi, the phone can be a good solution. The client can share documentation with the doctor, and the doctor can also share that documentation or include another doctors in the visits for have a second medical opinion. So the last one is the follow-up. After the end of the consultation, the client receive the prescription, electronic prescription. We send a mail and SMS to the client to check the health status, if they are better or not. And a feeling satisfaction questionnaire is important to us to understand if the clients are satisfied with us or not, for we can improve. This is our medicine experience. So what we saw with the user of symptom checker. So the evolution is 2020, 2021 is very high, more than 200%. The assessments we have in 2021, the urgency level is to self-care is much more than in emergency care. It's normal. And if you see the 24%, 54% is eligibility to use the telemedicine. So if the client have telemedicine and make a symptom checker, and if they have a low urgency level, what we are doing is refer the client to teleconsultation. The first call resolutions is important to us to understand what happens in the next 7 days after the symptom checker. And what we see is 74% of the clients use the symptom checker don't have any visit, and 21% have a visit. The other side for the teleconsultation, the increasing is much more higher in 2021 than the symptom checker. The first call and important is we are avoiding 15% of the acute care visits with the teleconsultation, and the costs for the side of the payer and the side of the customer, the costs for acute care visit is much more higher in Portugal than use a teleconsultation. So we are giving to the customer more accessibility, more cheaper way to access to their to the health. The first call resolutions, it's important in the teleconsultation for we understand what will be the behavior of the client, and if the client use a teleconsultation, they need more after the teleconsultation. They need to see a doctor in a personal visit. No, it's not what we saw in 2021. 96% of the customers who use a teleconsultation don't require in 7 days to use a physical visit. Only 4%. Is exactly the same number if the client start to use a physical visit in the next 7 days. They have some issue or don't solve what they have and need to go another visit. In the side of the prescription, in acute care, if you compare with acute care, because the main users, the main symptoms and customers use teleconsultation since it's related with acute care, and the prescription was exactly the same, the type used for a physic visit. 6% was drugs, 40% is drugs, and in exams, in the exams, 23% was the PCR. The PCR, the context, because in 2021 we have still COVID, so it was common to prescribe that. This year we don't have the same numbers, but the type of prescription is very similar with a physical visit in acute care. The only difference is it's much more cheaper, the teleconsultation and the prescription by a teleconsultation visit than a physical visit. So today we have, for the side of the insurers and the payers, lower costs with access to the health, and for the side of the final client, have a best journey, a best customer experience to access to their health. So I think the future will be improve the digital ecosystems where we have better access. We are corresponding according the needs of the client, and the client will pay less than they pay today. So if you have questions, feel free, and thank you for see the presentation.
Thank you, Tiago, for your insightful keynotes. I'm sure our eminent delegates have benefited from your enlightening keynote speech. I don't see that we have any questions in the comment section or the question section, but in case we do happen to have any in a while from now, we will definitely reach out to you with those questions. Thank you once again for your time, and hope you continue to enjoy the rest of the session. Thank you.
Thank you. Thank you. Thank you.
My pleasure.